Hi, welcome to Animal Talk. My name is Robin Kahn, and this is my dear friend, Dr. James Sawyers.
Hello, Robin.
Oh, and we have Lucifer.
Yep.
This is just a blank tape, dude?
Yeah. It's just the blank. For a second, and then I typed it on. Actually, Hi, welcome to Animal Talk. My name is Robin Kahn, and this is my dear friend, Dr. James Sawyers.
Hello, Robin.
Oh, and we have Lucifer, our
Yep,
other
Lucifer,
dear
our
friend
demo
here.
cat.
Yes, and
Volunteered
Lucifer's,
again.
I know he volunteered again, and you know something? It's amazing how you really can train a pet. Because Lucifer is more
He's getting more at home.
and more comfortable. We had one terrible experience one night where he took
Took
off
off
and he
and
hid
ran
in
him
all
behind
our
all the sets,
plants,
yeah.
and we were searching around, but he's doing good. So that proves that the cat really can be trained.
You can train a cat to do many, many things, tricks, and it's just a lot of matter of just getting him exposure to a certain situation or set of circumstances. He actually began to enjoy coming on the show, I think about 4 or 5 shows ago, when our demo critters didn't make it, or like tonight we're going to have a rabbit to show some rabbit characteristics, but that's going to have to be another night because he couldn't make it in tonight. So Lucifer volunteered again. Good kitty.
Well, does it show that their behavior can be modified a
Absolutely.
little bit by what they're doing?
Sure.
For instance, we've all had that experience where you take out your cat carrier and your cat runs the other way and then try to find him. So they could turn that into a positive experience by taking it out at odd times and putting cat treats in it or something.
When you're going to bring your cat only to the vet or only to the groomer, of course the cat carrier does not have a wonderful connotation, and so the sight of that carrier means, oh no, something bad's going to happen, and the smart cat disappears, makes himself very scarce.
That's right.
Now the opposite corollary of that is that, have you ever seen the cats come when for people who feed the canned cat food, you turn on the can opener, grrr, and the cats, zoom, come out of nowhere. I'd been on a couple of house calls where they'd had like 5 or 6 cats. 2 of them were there when I got there, and the other 3 were off running around. And so the lady said, well, just wait till I call them, turn on the old can opener, and they came rushing right into the kitchen.
Oh, that's funny.
Trapped.
Trapped, yeah. You know, it's interesting. People have asked me, too, is it true that you really can groom a cat and it can get a bath?
Oh, sure. They don't need it as much as a dog, really.
Because they bathe themselves, but they really can be groomed, and sometimes even cats with short hair.
Sometimes they have to be groomed, especially when they start to pick up some external parasites like fleas or lice or things like that. You don't bathe cats a whole lot as a general rule, but he had fleas one time. He chucked them in the old bathtub and used the old flea shampoo and clean them all off. And see, you see fewer and fewer fleas these days because of the new once-a-month spot-on products that prevents them so much better than they used to.
I met this lady in the clinic. I do a little volunteer work once a week, which I enjoy.
Source of many questions. Yeah.
Yes, and she was saying to me, well, what can I do? I have 2 birds. She had 2 blue parrots or macaws, and she was afraid that if she used a bomb in the house, she has 1 cat, 2 birds, that would hurt the birds.
That's quite true.
So I told her about that little X marks the spot and about the once-a-month flea pills, and she was going to use that.
Well, that's fine for the cat, but if you've got fleas in the house already, you'd have to remove every living thing. So, and birds are especially sensitive to many gases and toxins. Think back, what did they use down in the coal mines to test whether the coal gas was becoming toxic? They had a little parakeet down there. When the little parakeet went clunk, they knew that the gases were getting too unsafe for human consumption. So that whenever they set off those fogger bombs to kill fleas and other parasites, you must get all living things out of the house, or they will not be living too well.
Well, that's what I told her, and that's why she didn't want to do the flea bomb, because she didn't want to bring the birds elsewhere. I said, but if you really have to get the fleas under control, then you're going to have to take them out of the house.
What she might have done is to take the birds, move them upstairs into a bathroom, put damp towels along the bottom of the doorway, and even tape it shut so that no air or no chemicals get into that bathroom. Then she could set off the bomb safely, leave the house herself, and her cat has to go with her. Every living, cover the goldfish bowl with a saran wrap so nothing gets down into the water, and leave for 4 or 5 hours. Then come back, move, air out the place a little bit, move the kitties downstairs into the bedroom, and then either a hand pump or a small bomb to do the bathroom with.
No, because when we have fleas under control, we don't realize it. But if you've ever had that problem where fleas are out of control, it's just totally overwhelming.
I met a lady from Winthrop last year, and she set the world's record for she bombed her house 6 times.
Oh, wow.
She was so upset. She almost had to go through therapy. I won't mention her name, but come April 1st of '97, she was in and bought all the prevention products, because even though she used the prevention products last year as recommended, there were so many eggs and larvae in the environment of her cellar that she fogged. She used my foggers. She was a hardware store. The bombs, the hand pumps I had, tried Petco. She just had eggs coming out every 2 weeks, and so she had to, they hatched into larvae, into adult, and then off she went to the cycle. Had to go multiple times.
Oh, imagine that. And so what happens with everybody's bedclothes and rugs? You have to put...
Well, she was lucky because it was primarily down in her basement, so she didn't have to destroy the whole house every time.
That's the worst,
but she was having, she'd just walk down to her laundry room and the fleas would just jump on her legs.
Oh.
And so she didn't want to put her clothes on because they had fleas in them, and it was a whole big thing. And
it's a funny thing.
Winthrop still have that nudity law. Wouldn't allow that going on at all.
Well, it's a funny thing. You think of fleas as only being attracted to animals, but actually they are attracted to people.
They will bite any
warm-blooded
animal.
Just like animals,
They
right?
prefer dog and cat blood a lot more. Black cats are tough to find fleas on. They can hide in there, and you could never spot the little buggers till you get them in your house. And that's the hassle. They jump on the cat or the dog, suck a little blood, then jump off into the environment. And they lay eggs, and they just keep on multiplying. One flea can lay 50 to 100 eggs a day, so at the end of a month, you've got a significant number of bugs hatching out. And they go from an egg to a larvae to a cocoon phase. The cocoon phase is like a little bomb shelter, so none of the chemicals will really get through that cocoon phase. And in a couple of weeks, 2 or 3 weeks, under proper temperature and humidity, that cocoon will hatch out to a brand new adult.
Oh, imagine that. So that means that if someone is moving into a new apartment or house, just in case there are things like this going on, they should really bomb the house before they go in.
It wouldn't be a bad idea. It wouldn't be a bad idea.
But
you'll have an idea, because you'll find out from the realtor or from the landlord were there pets or cats or dogs in that apartment before. Usually that information is available, and sometimes, yes, it is. When you walk into the place, if the place has been empty for a couple of weeks, those fleas will be hungry. They'll jump on you. You can't miss that one.
No, I know it. And we were going to talk about what age does a pet become what you call a geriatric pet? I mean,
we
Lucifer
don't call them geriatric.
Well,
we just call them
if they've
golden
been
years.
Golden years, okay.
Well, we start actually, in both dogs and cats, I start to run blood work as a requirement, and that's kind of a signal that I won't touch your pet with anesthesia or anything strong without a complete blood test to check to make sure everything's functioning. It's about 7 years of age.
What does a blood test entail? Sometimes people hear the word and they think of what they go through at the hospital, and you picture it's so uncomfortable to have needles and things.
Well, it's not what I'd call a thrill. It's very similar, actually. We draw blood either from a leg or from a neck, shave the fur on the neck because that we can see the vein a lot easier. We'll just draw. It depends what test you're running. Now, the most common test that we run up at the East Boston Animal Clinic for pre-op and older animals is what's called a chem screen or chem profile. And that will give you about 16 to 20 tests with one sample of blood. It checks for diabetes, your sugar level. It checks for kidney failure, your BUN creatinine, liver disease, liver problems, all the basic electrolytes, and a few other protein levels too.
Oh, imagine that. Now, if a pet was in early kidney failure, or you had some type of a problem
well, that's the whole idea. See, that's where I've had more than one time, actually, that we bought a new blood machine this year so we can actually get the blood test run right away, instantly. And that machine has saved 2 lives that I'm aware of, where a 4-year-old animal came in, looked fine, just had to get his teeth cleaned, and we ran a blood test, and boom, he had a BUN of 80. The owners had a right to check off what they wanted done, and that lady checked it off, and we knew not to do it.
Tell everybody what a BUN is. Sometimes there are people out there who don't really know.
I can't believe that. Well, okay, BUN stands for blood urea nitrogen. It's a measure of waste products that are in your blood waiting to be filtered out by your kidneys. I.e., if your kidneys aren't working well, your waste level builds up, nitrogenous waste from protein breakdown, BUN, blood urea nitrogen. The higher the number, the worse shape you're in. A normal BUN in a cat or dog's around 20, 25, something like that. And when you have an animal whose kidneys can't excrete anesthesia properly, then they have a risk of never waking up.
Oh, okay. And I know you have different types of anesthetics.
We have a very wide menu we can choose from. We have like, well, I think probably the safest one I prefer is isoflurane, but it's more expensive than halothane or some of the injectables because it's just a more expensive medication to buy. It is preferable in the older animals. I've been using it more and more as the quality is just so obvious.
Yeah, so that's a good thing to do, to have this blood test. When you have an animal,
oh yeah, definitely. Well, see,
when a pet comes in and he's about 7 years old, it's mandatory.
That's right.
That he
Feeding back
has
to your question is that we start to consider, as the vets in our practice, your pet is older right around 7, because I won't touch him. If you won't let me run a blood test, I'm not going to do anesthesia or surgery on him, because we don't want to find out we have a problem the hard way. We're even doing more and more screening, even in younger animals these days, just to you know, just like they do for you when you go to your doctor.
And I understand they have a lot of specialists for pets. Now, let's say, well, my sister's dog, you've all seen Rennie off and on. He had juvenile blindness, and Dr. Sawyers was saying that only happens every once in a while.
Don't see that very
often. The dog
often.
has had everything that only happens once in a while.
Purebred dogs are often, you know, a breeding ground for all kinds of genetic problems.
One day he goes to the groomer and he comes out, he looks absolutely beautiful, like a well-fed poodle, all gorgeous. And then the groomer said to me, "It looks like your dog is blind in one eye." And I said, "How could that be?" And then I looked at his eye and I got all nervous. It was like, it was such a gradual thing, but it like happened right away. Then I took him in and Dr. Sawyer said, "That dog has juvenile blindness." So
I've seen it. It's genetically related.
Yeah.
And the other eye is affected. One eye is blind, the other eye is affected, but he can still see okay. He can get around.
So he goes to a dog ophthalmologist.
That's correct. We refer him out to an ophthalmology specialist. When the other eye becomes totally blind, then we'll go ahead and schedule a lenticular cataract surgery. They'll remove the lens that's opaque, and luckily dogs don't need a plastic lens put in like my mother had to get, but they'll go ahead and just take that lens out and the dog will be able to see again in a decent visual acuity. Not, you know, couldn't read a sign maybe, but he can see okay.
And now I understand too, they're doing operations where you could get a transplant for your pet, like a heart transplant or a kidney transplant.
Yeah, they're doing, at Angel Memorial, they're doing kidney transplantation, and so that's where we're forming ourselves more and more along the same lines of human medicine. With, you know, I'm a general practitioner. I see everything. I do a little bit of everything. But when I can't do it, then we now have, in Boston, we're lucky, we have many specialists where, a skin problem, Dr. Anderson over at Angel, orthopedic surgery, we may have a couple of board-certified people at Angel or in Wakefield and in South Shore Vet Associates, so that depending on what your specific patient's needs are, we'll pick you the right specialist and send you there.
Imagine that. And does that require a lot of extra schooling for a veterinarian, just like a regular doctor, if they decide to
Yes, they have to go on and specialize. Probably they go work as a resident first. Or actually, they go on from an internship for 2 years after they get out of vet school, then on to a residency for another 2. Then they're qualified, if they've taken the courses and worked with the specialist during that time, to sit for the specialist exam.
Imagine that. Isn't that interesting?
Well, it's just,
you know, there's so much going on and they're learning so much.
Their knowledge doubles every 10 years, and I've been out of school, well, almost 20, not quite. And so there's almost 2 or 3 times as much known.